to hepatosplenomegaly. Kalayarasan, 7 years old male child, third born to second degree consanguineous marriage, brought by his father Rajendran from Jamuna Marathur Hills, whose reliability is fair. The child is brought now for blood transfusion, which he has been receiving for the past 4 months. So it's a high incidence of thalassemia, sir. It's a tall belt.
Thenmathur Hills, they have anemia because of thalassemia. They have a sickle, and they have a sickle with thalassemia combination also. And there many kids are presenting with a macrocytic anemia, especially with the B12 deficiency. Some cases having folic acid deficiency also. So that's why I highlighted the Thenmathur Hills. Okay.
History of presenting illness. The child had pala since 10 months of his age, which was aggravated over his growth period and was noticed by his mother 4 months ago when he was 7 years old, for which parents seek medical attention. Later he has been investigated at local hospital and found to have anemia and referred to CMC for further evaluation. After 1 month, he was diagnosed with chronic anemia and was counseled to take blood transfusion regularly. From then, the child is on regular blood transfusion for past 4 months, once in 28 days.
Sorry, this child is not that child. Okay, this particular child. This is coming to our hospital for regular transfusion. I am sure this child will be for your whole clinical examination. So please read. Okay, definitely this child come to you for as a clinical case. You can, somebody can, if possible, can present this child also within 5 minutes. Any volunteers? Any volunteers, ma? ஒரு 5 நிமிஷத்துல பாருங்க, சும்மா வயித்தை தொட்டு பாருங்க, ஸ்ப்ளீன் இருக்கா இல்லையானு. ஏமா ராஜஸ்ரீ, why not come? சும்மா பாரு, பார்த்துட்டு உன் ஃபைண்டிங் எழுது. வா, 2 பேர் அதை பக்கத்தில் இருக்க பொண்ணையும் கூப்பிடு. வா.
Of failure to thrive, growth retardation. No history of pica, deterioration in scholastic performance, breath holding spells. This and all to rule out iron deficiency anemia. No history of discoloration of knuckles to rule out megaloblastic anemia. No history of change in color and texture of tongue and cracked lips to rule out iron deficiency anemia. No history of reddish discoloration of urine is to rule out hemolytic uremic syndrome. History of yellowish discoloration of eyes, so hemolysis has taken place. No history of abdominal distension is to rule out ascites. No history of any drug intake. Some of the drugs can induce hemolytic anemia, so I asked this history. No history of chest pain, palpitations, breathlessness, swelling of legs and decreased urine output. This is to rule out congestive cardiac failure. No history of fever with chills and rigor. This is to rule out infections like malaria. No history of loss of weight, loss of appetite, bone pain. This is to rule out malignancy. No history of leg ulcer. This is to rule out chronic hemolysis. Chronic sickle cell anemia.
Sickle cell anemia. Very good. Okay. So go to the first slide, ma. Sorry. ஃபர்ஸ்ட் ஸ்லைடுக்கு போ, அதில் ஒரு முக்கியமான விஷயம் இருக்கு. ஸோ வாட் இஸ் த இம்பார்ட்டன்ட் மெசேஜ் இன் திஸ் சைல்ட்? ஜம்னா மருத்துவர் வந்து கல்வராயன் ஹில்ஸ். ஸோ தெர் இஸ் அ பெல்ட் ஆஃப் thalassemia in that area. Usually it is Sikhs and Parsis, some இந்தியா ஃபுல்லாகவே இருக்கு. ஸோ இதில் நம்ம ஊரில் இந்த இடத்துல இருக்குது. அப்படி தானே முரளி? Yeah, so we have a belt there. So it is very, very important. In Arunachal, Assam, if you go to Dibrugarh, I have seen in a single day they will be transfusing for 100 children. 5 ward full of thalassemia ward. I was stunned by that. In ICH also we do some Monday unit. I was there for nearly 30 years. I used to give some 10 patients every Monday, they will come. Okay, but not like these places. Some 100 children. You will be terrified, no? All blood hanging there. I don't know, they would say. We should appreciate those people. Okay. Okay, next. Next, okay.
Past history. The child had not been admitted for any medical or surgical illness. Yes, sir.
Then there should be admission, no? For transfusion. That is
Sir,
for
before 4 months only they diagnosed with
If there is a history of transfusion, without admission, how will they give transfusion?
yes.
You cannot say if they have not been admitted. Okay, that is a wrong statement. No
You
problem.
have to say previous history of blood transfusion for the same for this condition. You can tell.
Okay.
Don't say not been admitted, no? Then you should already been given transfusion link, no? From your day of examination. Today only you are examining. Presume that today you examine the case. Previously at the transfusion, then you have to say past history similar for this complaint. Child had received a number of transfusion, multiple or 1 or 2 something. You can tell. That gives a significance of the requirement of blood transfusion for the child.
Drug history. This child is not on any chronic medication.
What?
Chronic medication to anticipate the child.
Sir, some of the drugs can induce hemolytic anemia, sir, like penicillins, cephalosporins, and anti-malarial drugs like quinidine. Primaquine can cause G6PD deficiency.
You know, acute, one tablet will produce. So you are talking about maybe chronic medication will produce some bone marrow depression that can produce, and also any chronic hydantine can produce megaloblastic anemia, isn't it? Okay.
Sir, you have to say the anti-epileptic or any chemotherapy for long-standing medication, they can have bone marrow suppression drugs. You can say chronic medication. For Primaquine, you cannot say. That is for only acute causing some hemolysis. Correct? So, is that on transfusion, do you anticipate any child to have a chronic medication?
No, sir.
What medication you give if the child on a repeated blood transfusion?
Iron chelators,
Iron
due
chelators.
to iron overload.
Okay, maybe would have, this drug would have caused this anemia, or the drug for iron overload or that may given also complication for which the child would have been admitted. Okay, you commit on chronic medication, you have to say what is the cause or the any drug you are given due to transfusion also.
Antenatal history. Third pregnancy. Mother was 26 years of age during his spontaneous conception. Pregnancy confirmed by urine pregnancy test. Booked.
What is the relevant history in this child? Can you tell? It is a hepatosplenomegaly. What relevant history here?
Recurrent.
No, torch infection. Infection can have hepatosplenomegaly, thrombocytopenia, then anemia, all those things. Anything else you can ask for? In anemia, antenatal anemia also can produce the deficient stores in the baby. The mother is anemic. So whether had any blood transfusion, IV, iron therapy, all those things. RH incompatibility, okay, or sometimes spherocytosis, hereditary spherocytosis also can produce some jaundice and anemia. Okay, right.
First trimester, no history suggestive of torch infections. Natal history, delivered at home, full-term normal vaginal delivery, later went to hospital for vaccination. Birth weight was 2.5 kg, cried immediately after birth, breastfed within 1 hour. Postnatal history, no history of
Why they didn't go to the hospital, ma? Did you ask? Suddenly, precipitate labor mari vandirukku.
Sudden labor pain, spontaneous delivery.
Okay,
they are
right.
from tribal area, hilly areas.
Oh, correct. அங்கிருந்து வர்றதுக்குள்ளே குழந்தை பிறந்துச்சு. Oh God. சரிம்மா. It's a, you will not know. Even in Tamil Nadu, there are a lot of places in hilly area, they cannot come down. They will be carrying with doli. Doli, yeah. There are துணி கட்டி தொட்டில் மாதிரி எடுத்துட்டு இப்படி தான் வராங்க. அவன் வந்து சேர்றதுக்குள்ளே போய் தருவோம். குழந்தை டெலிவரிக்கே அப்படி தான். ஓகே. We are gifted to be in a city of Tiruvannamalai, okay?
So last week I went to Gandhinagar with our Vice Chancellor to visit that PAC. As sir said, that's nearly only 40 or 50 people are there at Gandhinagar. All young adults have gone to Bangalore to work, the only earning to survive them. So many times they cannot be transported or shifted also from, if it is some far place. So they have their own transport problem also, but usually we must have institution delivery only. There should not be any home delivery, that is our target.
Even during our, recently some people died, some 50, 60 people died of some alcohol death, no? They say it is a very underdeveloped place, Jamnamathur, Kalvarayan Hills and all. Okay, next.
Postnatal history, no history of neonatal jaundice. This is to rule out erythrospherocytosis. Exclusively breastfed for 6 months, continue till 1.5 years.
Is it breastfeeding is good for prevention of anemia?
Yes, sir.
How? It is content,
Iron
the iron content is very low. I think 0.5 milligram per liter or something. It's very low when compared to cow's milk.
No, sir. Cow's milk.
Illamma, content low da. Analum good, yeah. Huh?
Immune
The
response.
bioavailability of the iron is good. The absorption is more than 50%. In cow's milk and other plant sources, the absorption is very limited. Bioavailability is less. It interferes, calcium interfere with iron absorption, phytates interfere with iron absorption, your tannin, சாப்பிட்டுட்டு டீயை குடிச்சோன்னா அது it will interfere, tannin will interfere with the iron absorption. Okay, your calcium, all those things will, oxalates will interfere with the iron absorption. Which one will improve the iron absorption?
Sir, vitamin C.
Vitamin C, very good. Okay.
Complementary feeding like green leafy vegetables, fruits, egg was
What is
taken
the best
after
source of iron, ma?
moringa drumstick leaves.
Drumstick leaves. Murungakkierai. King of kierai is Murungakkierai. Why? Only iron. But still the problem is phytates. It's interfere with the iron absorption. Where என்ன இருக்கு முருங்கைக்கீரையில? அது மட்டும் தான் இருக்கா?
Calcium. Calcium.
கால்சியம் அதுக்காகலாம் சாப்பிட்றது இல்லை அதை. வேற எதுக்கு சாப்பிட்றோம்? பட் வாட் டஸ் இட் கண்டெய்ன்பா? ஐ திங்க் ஏமா ஒரு நியூட்ரிஷன் கிளாஸ் எடுமா, எல்லா முருங்கைக்கீரை அந்த கீரைலாம் எடுத்து வச்சு ஒரு கிளாஸ் எடுமா ப்ராக்டிக்கலாக. இட்ஸ் வெரி வெரி சீரியஸ். முருங்கைக்கீரையில் என்ன இருக்குன்னு தெரியலன்னா என்ன பண்ணுறது? முந்தானை முடிச்சு பாருங்கப்பா படம். படம் பார்த்துருக்கானுங்க போல இருக்க. ஐ தாட் இட்ஸ் அ வெரி, இவனுக்கு 40 வருஷத்துக்கு முன்னாடி வந்த படம்ல. நீ பார்த்துருக்கியா முந்தானை முடிச்சு? சரி பரவாயில்ல, அப்புறம் பாரு, கல்யாணம் ஆன அப்புறம் பாரு. ஓகே, அவளை எங்க புது பொண்ணை காண. ஐயோ, ஓகே ஓகே, ரைட். So it contains vitamin A and iron and also protein it contains. Okay, so vitamin A, Murungakkiri is the best kீரை. Can compared to all, it is cheap also, but people don't eat little when compared to அந்த சிறுகீரை அது இதுக்கெல்லாம் கொஞ்சம் டேஸ்ட் ஒரு மாதிரி இருக்கும். ஓகே.
After 2 years, after 6 months, up to 6 months, fetal hemoglobin does not contain beta globin chains.
So the question is, when does thalassemia present? Thalassemia, beta thalassemia. He said it is not more than 6 months, below 6 months. Okay, below 6 months it should appear. Then only it is thalassemia, because the fetal hemoglobin up to 6 months it can manage with your fetal hemoglobin. Okay, afterwards, unless you have the adult hemoglobin, the child will not have, cannot survive. But in this child, it survived up to 7 years.
Sir, but in very rare cases, fetal hemoglobin may present up to 5 years.
I don't know. Is it like that? I don't know. He says it could be thalassemia intermedia. Only possibilities it could be, that also it present after 2 years. Thalassemia போய் எக்ஸாம்ல போய் 7 வயசுன்னு சொல்லாதீங்கம்மா, 6 வருஷத்துக்குள்ளே வந்துரும். It will be severely paler, it's less than 7 grams. Unless you transfuse, the child cannot survive. So it is a transfusion dependent thalassemia. Non-transfusion dependent thalassemia are like thalassemia intermedia, thalassemia trait like carriers and other thing. Okay, so that is a message. I have to look into that. It is, the history says 7 vayasula vandadu cannot. I hope you agree.
Yes, sir. So you told on some complement feed vegetables. What are the nutrition deficiency will cause anemia?
Iron
Iron
deficiency.
deficiency.
Iron deficiency. Next.
Folic acid.
Folic acid
Folic acid.
deficiency. Vitamin B12
Okay,
deficiency.
next. That's been commonly asked question. Even though I already answered for that.
What is the best source of iron?
Vitamin C rich foods, green
Vitamin C rich food.
non-veg meat.
Non-veg. அன்னைக்கே கிளாஸ் எடுத்தேன்ல, animal meat, I mean mammal, I mean what is the red meat? It is a heme iron, is better absorbed. Okay, it's a red meat is the best source, but it is so costly. I don't know, even நீ எனக்கு red meat சாப்பிட்டுட்டு இருக்காங்க. Okay, so it is a little costly, but iron supplement is the cheapest source. It is available in hospitals, very cheap, not freely it is given in. It's maybe a better option for anemic in our poor community. Okay, right.
Developmental history.
Next, quick, next. So no family history of
Gallstones.
similar episode. There is, okay, any transfusion, all okay. Next.
Second degree consanguineous.
Yeah, you have to put a double line, then only it shows it is a consanguineous parents தானே. ஓ
Second degree consanguineous.
ஓ மாமாவை கல்யாணம் பண்ணிட்டாளா?
Yes, sir.
ஆ ஏம்மா? Okay, next. So it's all important. In an anemia case, nutrition is important because too much of milk will produce anemia. Okay, it can produce microbleed, acal bleeding, then produce anemia. நிறைய பாலையே குடிச்சிட்டு இருக்கோம். I have seen ஒருக்கா கேஸ் கூட நம்ம கிளினிக்கல் சொசைட்டியில் ப்ரெசென்ட் பண்ணோம். அங்கே only on milk was severely anemic. Okay, so it's dangerous. Okay, next summary.
7 years old boy from Jamuna Maruthu Reels receiving blood transfusion for the past 4 months presented with pallor, yellowish discoloration of eyes with no significant family history suggestive of transfusion dependent thalassemia major.
Okay, we will have more discussion, but my opinion, it cannot be beta thalassemia or Cooley's anemia, no? So because it should present before 6 months. Okay, because it cannot survive this much. I don't know. You can ask him to trace this boy. He will be coming. Our people also going. So you can trace. I find it very abnormal. It cannot happen. I have not seen. Okay, even intermediate can survive up to 2 years. Okay, that may be probably it's a intermedia. Okay, நீங்க சொன்னா போதும். Okay, thalassemia. What are the causes of, I mean, okay, but next. Okay, quick up.
So continuing the presentation with examination. On general examination, the child appears conscious, comfortable, he is very cooperative with afebrile.
Okay, chipmunk face means what?
Sir, this is chipmunk. So this is the boy we examined. On comparing, he had frontal bossing, increased intercanthal distance, and a flat nasal bridge, and his tooth alignment was not in proper.
அணில் மாதிரியா இருக்கு இல்லப்பா சிப்மங்க்னா இப்போ see maxillary
prominence
எங்க இல்லையே அந்த இது வேற அணிலா இருக்கும்பா இந்த அணிலுக்கு மாதிரி இல்லையே but chipmunk means squirrel, one type of squirrel, so it's a frontal bossing, depressed nose, maxillary prominence. Okay, quick, because of the extramedullary erythropoiesis, this what is it? Bone marrow is expanded, all this bone marrow, because of the ineffective erythropoiesis going on, producing RBCs which is destroyed, okay, in the spleen. Okay, next.
Says
Next.
Systemic examination. On inspection, that abdomen appears light distension on upper right and left quadrant. Umbilicus appears to be in midline with inverted in shape. No scars, dilated veins, and no visible pulsations. On palpation, no tender, no warmth.
What about flanks?
Flanks was normal, sir.
Flanks
was normal.
It is
Yes, sir.
free one.
Only upper abdomen, this right side and left side was.
You have to comment on. Okay, there may be some mild effusion also, the fluid also. Then clinically you may have to have a different examination also.
Okay, sir. Liver 7 centimeter palpable under right costal margin along mid-clavicular line, which is firm in consistency, sharp border felt.
This is also quite unlikely. In a thalassemia, it is splenohepatomegaly. You understand? The spleen will be more than the liver, because all your RBCs are destroyed there, so spleen going on increasing. You will have hypersplenism. But this is quite unlikely, because liver is more than spleen. It's quite unlikely. Next. Oh.
Sir, first we did palpation, sir. On
Span means
liver
from the
span,
upper border to lower border.
On percussion we did liver span, sir. Just we palpated from left.
From
right
the
costal
lower
margin,
costal margin, it's okay, okay, no problem.
On percussion, liver span was found to be 10 centimeter, which depicts mild hepatomegaly, and spleen span is 12 centimeter, which is massive splenomegaly. He had massive splenomegaly.
Okay, massive splenomegaly. Next.
On
Okay,
auscultation,
one minute. Emma, Rajshri, come. What is your finding here? Just give me 4 lines, you give your findings.
Sir, on general examination, she has moderate pallor, sir, and her vitals, she is tachycardiac and tachypneic, sir. 23 beats per minute of respiratory rate and 23 beats per minute of respiratory rate and 93 beats per minute of pulse rate was there, sir. Respiratory rate, sir. 23.
So 23 is normal anyway. Okay.
And on abdomen examination after exposure, after getting consent, the liver was not palpable, sir, but spleen was palpable 2 centimeters from the lower costal margins, which is firm in consistency. And
so, if it's properly managed, properly transfused, you should not have hepatosplenomegaly. If it is huge, means you are not properly transfused, isn't it? So your erythropoiesis, extramedullary erythropoiesis occurs somewhere because you are not transfusing. At what? How much hemoglobin you got to maintain?
9 to 10.
9 to 10.
Pre-transfusion.
Before transfusion.
Pre-transfusion 9 to 10. So ideal hemoglobin in a child, in this thalassemic child.
11 to 12, sir.
12 to 12.5 is the ideal one. If you keep that level, pre-transfusion must be around 9 to 10. Okay? If you go below that, then your extramedullary erythropoiesis will occur, huge hepatosplenomegaly occur. Then you cannot, the curative treatment is,
Hematopoietic stem cell transplantation.
Hematopoietic
Stem cell transplantation. Hematopoietic stem cell transplantation.
stem cell transfusion. Stem cell transplant thane.
Transplantation.
Okay. So you know BMT. Okay, it's a HLA matched donor you need to have. Now they even unrelated donor you also can donate. There is called detrite. You can go to the Google and Revadiraj has started that. If you are willing, then they will do a HLA matching. So it will go to all over world. So they will find out some thalassomic children HLA matched. Then you may go to any country and donate. I don't know. That is acceptable now. So many, even one child is coming to our OP with bone marrow transplant done. It's a curative. Okay, if you are not managing well, you cannot do a bone marrow transplant also. If you are not transfused properly, then all hepatosplenomegaly will occur. Okay, Pak.
Other system, serious. Apical impulse felt at left fifth intercostal space, half-inch minute to mid-clavicular line, and S1, S2 heard with no added murmurs. Respiratory system, normal vesicular breath sound, no added sounds, and CNS, no focal neurological deficit. Summary, 7-year-old boy from Gandhinagar Hills receiving blood transfusion for the past 4 months, presented with pallor, yellowish discoloration of eyes with no other significant family history. On examination, presence of pallor, icterus, hemolytic phases, hepatosplenomegaly, suggestive of transfusion-dependent thalassemia major. Diagnosis, a 7-year-old boy from Gandhinagar Hills presented with pallor associated with hepatosplenomegaly and a regular blood transfusion for the past 4 months with no significant family history, underweight with normal development, is diagnosed to be chronic hemolytic anemia of beta thalassemia major, not in congestive cardiac failure.
So you are given an option of doing only one test. How will you confirm? You are giving only one test. You can't just like that do this, that. Okay. One test you have to do.
HPLC.
Huh?
HPLC.
HBA?
High performance liquid chromatography.
Chromatography. Very good. So, you tell me.
High performance liquid chromatography.
So liquid chromatography, usually we do electrophoresis. Okay? Electrophoresis will show what? ஐஸ்வர்யா ஏன்னா சில பேருக்கு தான் பேர் தெரியும் அதனால கூப்பிடுறேன் அவ்வளோதானே ஒழிய ஓகே என்ன சரி அவர் ஓல்டு ஃப்ரெண்டு நாட் யங் ஃப்ரெண்ட் ஒன்லி ஓகே ஐஸ்வர்யா சொல்லுமா in thalassemia major what will you see? What are the type of hemoglobin you will see in thalassemia major? கொஞ்சம் பக்கத்துல வாங்க.
HbA2 and HbF will be assessed.
HbA2?
HB.
No, which one is very predominant?
HbA2.
A2? U2? என்னம்மா ப்ரிடாமினண்ட்டாக இருக்கும் என்ன ஹீமோகுளோபின் ஃபீட்டல் ஹீமோகுளோபின் will be more than 90%. It will be more than 3.5. HbA2 will be. Adult hemoglobin HbA will be absent. Very good. It will be absent in beta thalassemia. Okay, in intermediate adult, somewhat some smaller amount will be there. That's why, okay, thank you, ma. Okay, so what are the, anything, because it is quite unlikely in this child, 7 years on the beta thalassemia diagnosed pandrathu, it is quite, and I will go into the detail. Okay, so what other drug you like to give? Supportive therapy.
Iron chelators.
So iron chelating agents, என்னெல்லாம்?
Deferasirox. Deferoxamine.
Desferoxamine.
Deferoxamine.
இன்னொன்னு என்ன?
Defipron.
Deferisona.
Very prone.
Deferry prone. Okay, deferry prone. D ni போட்டுக்குங்க எல்லாமே deferoxamine, deferisox and deferry prone. So these are the desferoxamine is subcutaneous. I think nowadays they don't use, I think.
Because they cause
But it has a lot of side effect. You need to do CBC and monitor adverse effect.
Ototoxicity side.
Okay, ototoxic and I think some retinopathy also can occur. So now the father is asking you, what is the prognosis to my child? What will you tell?
Sir,
Whether என் குழந்தைக்கு கல்யாணம் பண்ணலாமான்னு கேட்குறாங்க, என்ன செய்யலாம்? உங்க பாலுமா அந்த நீ வேற சொல்லணும்ல.
Should be constant monitoring of hemoglobin and iron levels for first step. And then stem cell transplantation if possible.
So stem cell transplantation, that is a curative. It is covered under Chief Minister Insurance Scheme, done free of cost in Tamil Nadu. I think around 10 lakhs they are giving. Revati Raj in Apollo is doing. I think she is coming next month on 19th. I have invited her, Dr. Revati Raj. She has done more than 400 for the thalassemia children. I think, Emma, உங்களுக்கும் ரேவதி ராஜ் தானே பண்ணுறேன்னாங்க, டாக்டர் ரேவதி ராஜ் தானே இங்கே சில்ட்ரன்ஸ் ஹாஸ்பிட்டல் எக்மோரில். Aruna, okay. So she was also offered stem cell transplantation, but அந்த ரெண்டாவது குழந்தை உங்களுக்கு பிறந்திருக்கு, அந்த கார்ட் பிளட்ல ஏதோ நீங்க என்ன பண்ணீங்க? கார்ட் பிளட்ல ஏதோ கொடுக்கலையா? அது ஏன் திடீர்னு நீ முதல்ல அப்போ மெட்ராஸுக்காவது போயிருக்கலாம்லப்பா. இப்போ என்ன சொல்றாங்க?
அவங்க ஸ்டெம் செல் கொடுக்குறேன்னு சொல்லியிருக்காங்க. ஸ்டெம் செல் கொடுக்குறேன்னு இருக்காங்க. அவங்க 1,10,000 ஸ்டெம் செல் எங்கே இருக்குது நான் தரேன் அப்படின்னு சொல்லியிருக்காங்க. அப்படி இல்லைன்னா இதுக்கு பாப்பா இருக்காங்க, அது மேட்ச் பண்ணி செக் பண்ணி பார்க்கலான்னு இருக்கேன் சார்.
So I know because she was offered, அப்போ தான் சொன்னாங்க அந்த அம்மா ப்ரெக்னெண்ட்டாக இருக்கும்போது இந்த மாதிரி கார்ட் பிளட்டை கொடுக்க சொல்லியிருக்காங்கன்னு. somehow misfired, அவ்வளோதான், அவங்க கொடுக்கல. Otherwise probably you would have already done stem cell transplant. It is a curative. Otherwise lifelong, how long? I don't know. But what is the marital life? Because both genes are defective here. So, okay, if somebody not carrier, there is a 50% chance. Antenatally, they can, okay, chorionic village sampling, you can find out. If it is both genes are there, then you abort it. If both genes are good or one gene is good, carrier, then also no problem. So you can offer marriage also. That is possible. But everything is possible now. It is done by government of Tamil Nadu for free of cost. Okay? So anything else?
Here the approach for HEPATOSPLENOMEGALY can be adopted, sir. So like if you structurally look at the case, one infectious cause could be chronic malaria or leishmaniasis, then malignant cause with anemia, the inflammatory cause with anemia. So like that.
Exam they will ask you, what are the cause? Suppose the child presents the fever, the same child. So sir may ask a question, fever with HEPATOSPLENOMEGALY or anemia with HEPATOSPLENOMEGALY. You have to say different, infective, non-infective. Infective as a virals, bacteria, protozoa, fungal, you have to prepare for that. Non-infective also present with the fever. For example, any leukemia can present with the fever. You have to say other malignant condition also. Then storage, metabolic disorders. This should be prepared for HEPATOSPLENOMEGALY. And in exam they will ask you why you say that mass is a hepatomegaly. Then they will ask you why the mass is a splenomegaly. Many times you will have issues. You have to differentiate between the spleen and the liver. You have to say the point. For the spleen, do not look for the spleen span. Okay, you cannot look for the upper border. Only you can feel the lower border, that is crossing towards the umbilicus it goes. That only you can comment. Then we see whether hilum is present or not. whether it is palatable or non-palatable. Upper border cannot be insinuated. You cannot find the upper border, so you cannot look for the splenic. Don't comment on that. Then they will ask you for the transfusion related. They will ask for what is neocyte transfusion, what is hypertransfusion, then what is indication for splenomegaly. Those are things will be discussed for the thalassemia. So usually, as sir said, less than 2 years the thalassemia will present, that is a dictum, okay, not more than 5 years or 6 years you must have, as I said, maybe due to other condition, trait or something you have to think. Usually the presentation, it has to present less than 2 years. Suppose you are telling the Thenmathur hills having a many child, most of consanguineous parents, the risk is high. What test you do as a mass community level investigation to confirm whether they are having a screening test for thalassemia?
Prevention. So this is prevention. So there is a belt. What can you do? Some screening of the parents, no? Whether they are carrier. Carrier means what? Antenatal. Adu எல்லா பேரண்ட்ஸுக்கும் இஸ் a community. Some carrier means one gene is affected. So the child get to one from father, one from mother. So carrier means one gene is okay, one is, isn't it?
What is nephroph? Naked eye?
Sir, is it that hemoglobin A2 they do, isn't it, for carrier? அதான் என்ன பண்றாங்க?
Nephroph is naked eye. See, all correct. Somebody is told single tube test for red cell osmotic fragility test. Okay, we recently had some program in our Tiruvannamalai Medical College where all these faculty has been trained for doing this naked eye examination, single tube red cell fragility test, where they will be already prepared reagent where they take to the community and they do. When you come to college, they will prepare the fluids and then they will do it in the hospital base when you do a large volume. Okay, so this you must know as a screening test, very important. Then as sir said, when they will ask 2 questions, what is happened for my next child? Mother is pregnant, what will you do? So definitely now we are giving the counseling. It has been counseling with along with the state and then parents and the medical officer, DAC and the HOD of pediatrics has to give counseling in a Zoom meeting. Now because every time they cannot go to Chennai, they cannot come. What they now do is, there's a government of Tamil Nadu, we are having a Zoom meeting with the state level advisor, Dr. Shanti Madam, and with these parents and DAC and myself, HOD, will be in the meeting and will be discussing about what is the risk for the future child. This we decide before 20 weeks of gestation. The parents has to decide. Thank you, sir.
So this child, எப்போ உங்களுக்கு இப்போ 2வது குழந்தை பிறக்கிறதுக்கு முன்னாடி நீங்கள் கவுன்சிலிங் கொடுத்தாங்களா, என்ன எப்படி பண்ணோன்னு? நீங்கள் பார்க்கவே இல்லை அந்த குழந்தைக்கு, இப்போ பார்த்துருக்கீங்க. இப்போ என்ன ஆயிடுச்சு, அந்த குழந்தைக்கு நார்மலாக இருக்கா? நெகட்டிவ். ஸோ இப்போ எவ்வளோ நாள் ஆயிடுச்சு பிறந்து? 1 year ஆயிடுச்சு. ஸோ ஃபார்ச்சுனேட்லி ஐ டோன்ட் நோ, எல்லாமே நார்மலாக இருக்கா இல்லை கேரியர்னு எதுவும் சொன்னாங்களா? நார்மலாக எங்கே மெட்ராஸில் பார்த்தீங்களா? Okay, this child is getting blood transfusion here, but all ion chelation therapy from our DIC in Tiruvannamalai Medical College. Any doubt on all 4 presentation? Any doubt? No doubt. Okay, thank you. So I once again, excellent presentation. I congratulate Jayadevan and Tamil Amudu. Okay, for their wonderful presentation. They have taken a lot of effort. It is very easy to comment from somewhere and passing. It takes a lot of effort. On behalf of you, I thank our Professor Dr. Murali for coming here and enlighten us, and our children will be coming there. Please take care of all our children. Okay, so yes, he has taken lot of effort to, for you people to visit there. So please utilize the opportunity. It is not very easy to arrange something there or here. Okay. So please, today you go on and read about these 4 cases. Every day is a little bit. Don't postpone it. Finish it. Periodic posting வந்தீங்கன்னா அதோட முடிச்சிடணும். அதுக்கப்புறம் you will not have time, I am sure. You will not have 6 subject. How will they learn? Okay. So thank you once again. Okay.